Well, it's British Heart Week, and to mark this, we've got Dr. Sarah Jarvis on with us, who's going to discuss how we can maintain a healthy level of cholesterol to reduce the risk of medical conditions. How are you doing today?
I am doing very well indeed, thank you, Toby.
So, what are the dangers of having a high cholesterol?
Well, it's probably worth starting by putting the size of the issue into perspective.
Mm,
Almost half of adults in the UK have got cholesterol, which is higher than we would recommend from the national guidelines. Now, everybody needs some cholesterol. It's
yeah.
part of every cell in your body. You use it to make vitamin D to keep your bones and your teeth and your muscles healthy. But the problem is that, as I say, nearly half of us as adults have got too much of it. And the issue with that is that there are two main kinds of cholesterol. There's something called HDL cholesterol, which we often call good cholesterol, because HDL cholesterol basically takes cholesterol away from your cells, takes it back to your liver, and your liver can then break it down and get rid of it so you haven't got too much in your body. LDL cholesterol, if you've got too much of that, that gets deposited on the inside of your arteries. It builds up like furring up, like lime scale on the inside of your personal pipes. And what that can do is that can reduce the blood supply to your vital organs. But really importantly, what can also happen if you've already got those deposits of what we call plaques, those fatty lumps deposited on the inside of your arteries, then sometimes one of them will break open, it will rupture, and that can block the whole of the artery off, so it can stop any blood getting through at all. Now, everybody knows, I think, that you need oxygen for every one of your cells in your body to keep them going all the time. If that bit of your body is suddenly deprived of oxygen, if the part of your body that's supplied by that artery is the muscle of your heart, the result will be a heart attack. If the part of the body that's supplied by that artery is part of your brain, the result will be a stroke. So if you don't know what your cholesterol is and it's too high, then basically you are living with a ticking time bomb.
So how can we find out what our cholesterol levels are?
Well, that's a very good question. The first thing is to know what your levels are to get them checked. And the second thing is, of course, to talk about it. So a new survey from Novartis has shown that there is some good news there. The older you get, unfortunately, the greater your risk. There are other risk factors, but unfortunately, getting older is one of the big ones. Just over half of Brits have spoken about their cholesterol level with a GP, but unfortunately, you are, well, a lot of people who have spoken about it still don't know what to do about it. Now, the good news is that actually the Northwest is doing better than average in the UK. Yeah. It's not that much better, however. So the overall, about 1 in 11 people actually even know what good cholesterol is. In the Northwest, about 1 in 10 people do. So that is higher than average. And unfortunately, 19 out of 20 people in the Northwest didn't know that if you're aged 40 to 74 and you haven't had your cholesterol checked in the last 5 years, then you should be getting it checked through the NHS with an NHS health check. Now, you can get that from your pharmacy usually. Those health checks were to an extent paused during the pandemic, but they're very much coming back online now. And if you just go and speak to your pharmacist, they may well be able to give you a check, and they won't just do a simple blood test to check your cholesterol. They'll check your blood pressure, they'll take your weight, your gender, your family history, whether you smoke, all sorts of other things into account. And they'll be able to factor all of that in and tell you how high your risk of heart attack and stroke is. And if as a result your risk is higher than we would recommend, and that the threshold we say is if your chance of having a heart attack or stroke in the next 10 years is more than 10%, then you need to look at your cholesterol, and they will be recommending you make an appointment with the GP who can give you advice on what steps to take.
Yeah. Why do you think there is such a lack of awareness, I suppose, about cholesterol?
I wish I knew, because I've been banging on about it for 30 years. So maybe the answer is people haven't been listening to me for the last 30 years. I think the problem we've got is that there are so many things for us to think about, and it can be confusing. So, cholesterol is a bit confusing because the targets, for instance, a very, very broad rule of thumb is that if you haven't had a heart attack or stroke, you should be looking to have a total cholesterol that's below about 5 and a good cholesterol level of above 1. But the problem is that if you've had a heart attack or stroke, those targets are different. And I think the figures keep changing as we've had treatments which can reduce the cholesterol by more. Those targets have changed. And I think people just get confused.
Yeah. And even if we get our cholesterol checked out and it's all perfectly healthy, I suppose it's still important to maintain that, isn't it? So how do we maintain it and stay healthy, or bring it down if it is unhealthy?
Toby, you could not be more right. There's no such thing as somebody who is at no risk of heart attack or stroke, just lower or higher risk. And of course, the problem is that the same cholesterol level will put you at higher risk if you're 10 years older than it did 10 years ago. So as you get older, it becomes even more important. So for instance, things like improving your diet, little tweaks to your diet can really make a big difference. The ideal is looking at what we call the Mediterranean diet. Now there we're looking at lots of veg, lots of fruit, not too much meat, certainly not too much processed meat, more fish, particularly oily fish, less saturated fat. So we're talking there about, butter, lard, fatty meats and so on. More of the heart healthy oils. So that might be olive oil, rapeseed oil, but nuts and seeds also have very good in healthy fats, and much less processed food. So the white stuff, the white bread and the pastry and the pizzas and all of those other things. Then there's exercise, and ideally people should be looking towards doing half an hour of what we call aerobic exercise, the kind that makes you mildly out of puff, about 5 times a week. But if you can't manage that, any level will do. So simple, really simple things like, taking the stairs rather than taking the lift, or parking at the far end of the car park, or even not taking your car if it's a short trip. You'll save on petrol as well, and we all know how expensive that is these days. Getting on your bike, things like that will really, really make a difference.
And as well, I suppose these things not only help with cholesterol, but they help with your health in general. It fixes all sorts.
Absolutely. So of course, regular exercise can help you keep your weight down, and we know that keeping your weight within healthy limits, and unfortunately 2/3 of us in the UK are either living with either overweight or obesity. We know that keeping your weight within healthy limits doesn't just protect your heart, it reduces your risk of osteoarthritis, of tiredness, of breathing problems, all sorts of other things. So yeah, it's good stuff all round.
Yeah. And who is most at risk of bad cholesterol? Because there are some factors that you can't really control, like your age and sex.
You're absolutely right. So of course, the problem is that you are more at risk if you are older. You are more at risk if you're male, but if you're female, you are still at risk. So at risk. So you can't assume that you're okay. If you've got a strong family history of heart disease, this is really important. So particularly if a parent or a brother or sister has had a heart attack under the age of 60, or for instance, an uncle or aunt or a grandparent has had a heart attack under the age of 50, there we would definitely be worrying, because there is a condition called FH, or inherited high cholesterol. Probably about 1 in 500 people in the UK have got it. Unfortunately, about 6 out of 7 of them don't know that. And that's really important, because they are extra high risk of heart attack and stroke, and they really do need intensive treatment. So if you're a smoker, it doesn't raise your cholesterol, but it certainly raises your risk of heart attack and stroke. People from certain ethnic minorities, people of South Asian origin, unfortunately, are at higher risk of heart attack and stroke. People who've got a family history, and people who are not as young as they once were.
Some older people, more at risk though, might think, what's the point in living really old if I can't eat all the stuff I want?
I hear everything you're saying, and believe me, I have this conversation with my patients on a very regular basis. But the point is, this isn't just reducing your risk of heart attack, it's also reducing your risk of stroke. And although you might die from a heart attack or die from a stroke, and that would be dreadful, and you might say, well, I've had a good life. What about if you survived a heart attack or a stroke and you're left disabled? Your quality of life would just go through the floor.
Well, where are we able to find out more information around cholesterol?
I would suggest you trot along to the Heart UK website. So Heart UK is the cholesterol charity, and they can give you loads of information, not just about cholesterol, but also about inherited raised cholesterol, how you can make healthy changes, and they've got all sorts of practical tips for improving your diet and indeed improving your cholesterol levels.
Excellent. Well, many thanks for coming on the show today.
Great pleasure. Thanks so much for having me.